Good evening. Hi, it's Dr. Rodiales from the Georgia office. Um, Today, I am going to talk about when too much is simply too much. Too much of a good thing is actually a bad thing, or a good thing in the wrong time or in the wrong place is definitely a bad thing. So this subject was suggested by a beautiful friend up in New York because she did her own research and realized that she was taking the wrong supplements at the wrong time, and that it could be actually interfering in a negative way with her fertility journey. So I'm going to take just a few samples. One, the one that she actually brought up. So she had been taking a supplement for joint pain actually for a very long time, and she didn't realize that there could be some adverse interaction with her fertility medicine and actually decrease fertility. So glucosamide, we hear a lot about chondroitin and glucosamide for joint pain. Well, glucosamine can or is associated with decreased fertility and implantation issues. So needless to say, she was very disappointed to find that, and she was kind enough to share it with me so I can share it with you today. Another one that's huge in the fertility world, and people don't realize that, again, too much of a good thing is a bad thing, or a good thing at the wrong time is still a bad thing, is the DHEA. DHEA is actually an androgen, okay, so in the testosterone family, produced normally by your adrenal glands. And in the fertility world, in a lot of like support groups and forums, it is recommended to do 75 milligrams, so 25 milligrams 3 times a day. And the reason for that is that it has been associated with improved fertility, especially in older women. The reason that I think that those studies show that correlation is because most women past 40 will have decreased testosterone in general. DHEA, just like thyroid medicine, estrogen, progesterone, testosterone, it's actually hormone replacement. And just like any other hormone, I mean, think about how many times we check your thyroid levels, your, TSH has to be checked. So before you decide to use DHEA as part of your fertility enhancement items, I would encourage you to check your level and monitor your levels at least every 4 to 5 weeks to make sure it's in the adequate range. The adequate range or the accepted range of DHEA or the normal values are 80 something to about 350. In certain laboratory assays is up to 400. I personally like to see it somewhere between 150 and 200, which is kind of smack in the middle. So if you tend to have low testosterones, especially DHEA, just go ahead and start it and just make sure you monitor it. Why is it negative? Too little of it, it is associated with decreased ovarian reserve. So when you correct the deficiency, it actually enhances not only the quantity but the quality, and it's associated with improved pregnancy rates just because it affects the cells, the granulosa cells in the follicle, and then creates a better quality of eggs because of the cascades of hormones that it produces. But when you actually take it above normal, you are creating a PCOS like syndrome. So you're going to have all of the symptoms as a PCOS patient if you don't have the condition. That includes increased acne, increased insulin intolerance, okay, insulin sensitivity, um, hair loss, and at the same time, you're actually causing too much androgens in the ovary, too much androgens in that follicle, and then that causes more immature follicles and decreased quality, therefore decreased pregnancy rate. So please, please, please check on those things. Another thing that people ask me all the time is the different herbs. I personally do not recommend herbal medicine during the fertility treatment. There's certain herbs that can be taken. However, you have to be monitored by a healthcare provider that is very familiar with the herbs and its side effects, as well as the herb drug interactions. So, in general, I recommend people to stay away from herbs. I see a lot of people being prescribed by, Chinese medicine doctors, especially stuff like Chase Tree or Vitex. However, if you're taking that, I would encourage you to take it either when you're doing a natural cycle, so just trying on your own, or just, maybe some oral medication. But if you're doing anything other than that, no herbs at all. Some herbs are actually detrimental. What do I mean? For example, ginkgo biloba, which is used for memory, and is a vasodilator. It increases coagulation. I'm sorry. It's a blood thinner. It's a blood thinner, and it can interfere with some of the medications that you're taking. So imagine if you are doing ginkgo biloba, baby aspirin, Lovenox, you're actually maybe over the top and then cause a subchorionic hemorrhage, right? Too much of a good thing is actually a bad thing. Another one that should not be used is saw palmetto. It decreases testosterone. It is used for kidney health. It is used for male, like prostate. It is used in female also to level out androgens. However, it can interfere with your fertility drugs. There's nothing natural about IVF. There's nothing natural about injectables and IUI. So the least herb drug interaction we have, the better. Black cohosh is another big one. Black cohosh increases your natural estrogens, and it's going to interfere again with some of the fertility drugs that we're using. Okay, so I have a question here. So, what about herbal teas? Red raspberry leaf tea is okay. It is okay. Teas in general will have a lot less of the active component of the herb. Red raspberry leaf, it also is associated with increasing your testosterone. So I would use it sporadically. There's certain herbal teas like chamomile that will not interfere at all, doesn't have any effect on the endocrine system. Flowery teas will also, in general, don't have any interference. Green tea, even though it has a little bit of caffeine, will not interfere. Black tea as well. So another thing is too much of a good thing, again, it's a bad thing. So I wanted to point out some of the supplements or fertility enhancers. Vitamin E is another big one. It is very important for you to be doing a prenatal vitamin, not a woman's multivitamin or a general multivitamin, because prenatal vitamins are going to be a lot more regulated by the FDA because of all the implications to the embryo, and the concentrations of vitamins and minerals in them are going to be a lot more safer range. Excess vitamin E, for example, excess vitamin A, they're all the fat soluble vitamins, they actually can be teratogenic. What does that mean? It can cause birth defects. So again, interfere with a healthy pregnancy. So excess of vitamins is actually a bad thing. The other issue is with oils, for example. Not all omega-3s are the same quality. Some of them are processed with chemical solvents to extract the active component from, like, the fish oil, for example. And the solvent is not completely eliminated from the actual supplement. So a very easy test would be to do the styrofoam test. So if you get raw styrofoam and open your fish oil or your oil supplement and pour it on top of the styrofoam, see what happens. If it eats up the styrofoam, just imagine what it does to you, right? It should just stay there. It shouldn't stink. It should not, you shouldn't burp your omega-3. If you're burping your omega-3, it is rancid, and it actually will put a lot of stress on your liver and cause a lot of oxidation, and potentially you're trying to improve your fertility, improve your health overall. It's going to be detrimental with all the oxidative damage. Okay. The other thing is you have to be aware of all of the different supplements that you're taking, and that they could be repeated. Sometimes it's like, super fertility A, and then, this other one over here that you're taking, that they're different, have different components, or you're taking isolated components on top of that. That will add up and actually be detrimental. So in general, I recommend people to do a prenatal vitamin, ideally with a food-based buffer. There are several companies out there that are very reputable. Vitamin D, but not excessive. So 2 to 4,000 units. And again, monitor, just like I said, with the DHEA to make sure that it is in this 50 to 70 range. And then a good omega-3 that is clean. And I can definitely point out to you, if you write me through Messenger, Nordic Naturals, it's a good company that just came to mind. Standard Process is the company that I generally recommend. They're really good quality, very, very clean. And food-based supplements, like the glandular therapy, meat organs. If you want to do complex B, why don't go ahead and get a liver supplement? I mean, Dr. Kills has a liver supplement that you can definitely take. There's several companies out there that are very reputable as well. And I would keep it fairly simple. I generally recommend different supplements, but it's because I've been using them for a long time. So I know that the combination is safe for you. And a lot of times I tell people take them all the way to 3 months, but they're all food-based. All of the protocols that I use for my fertility patients are food-based and are safe all the way to 3 months of pregnancy. Again, stay away from herbs, especially when you're doing IVF or IUIs. Monitor your DHEA before you either start it or continue on it. Make sure you're on a prenatal vitamin, not a multivitamin, okay? Because it'll be a lot more FDA regulated about the concentrations and the quality of the ingredients in it. Be careful with your omega-3 supplements, and too much of a good thing is definitely a bad thing. All right, another question. I am in a waiting period for 6 months to a year before we can afford doing another IVF cycle. Besides taking CoQ10 and prenatal vitamin, any others I should be on right now? Should I even take the Q10 and prenatal for that amount of time? You can take it on and off. Definitely I would stay on the prenatal vitamin D and kind of a low dose CoQ10. You can rotate your supplements, so you can do like prenatal vitamins 3-4 times a week, and then do something like liver kidney, like organ meat supplements the other days until you are closer to the time you're doing your IVF. Rotating supplements is actually a great thing, because you won't get the same concentration of minerals and vitamins, and then you'll be able to provide your body, because that's how we are in nature. We're designed to get our nutrients from food, and we never eat exactly the same thing every day. So you can definitely, especially I see patients that are taking a pharmacy of supplements. If you feel very strongly about taking 20 supplements a day, why don't you rotate them? There are different pill boxes that you can put your week. So it has Sunday through Saturday, and then you can put the supplements that you're going to take, the beginning of the day, middle of the day, at the end of the day, and blah 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 blah. So go ahead and rotate your supplements. How do I do about seeing an immunologist and reproductive endocrinologist through CNY? I want to look further. So why my body isn't holding my embryos after the last 3 fresh embryos fails that I transferred. We don't have a reproductive immunologist in-house. There are different ones that will work with us. I, out of the top of my head, I can't recommend one. I'm sure that one of the ladies in the different support groups can recommend one. We are reproductive endocrinologists. That's what we do. That's what an IVF doctor is. But if you want something more specific, you want like another set of eyes from a different angle and a reproductive immunologist, then you should search it out and ask around. Okay. All right, so Miss Brandy has a very good point. So she's an IVF patient, 12 weeks pregnant. She was recommended to do Lovenox till 14 weeks, never had a history of loss or clotting. Her OB wants to switch her just to aspirin, and she's never heard, because she has never heard of Lovenox for IVF, and she is torn. Um, so this is a great moment to make a parenthesis, because I see this a lot. A lot of regular OBGYNs are not familiar with the IVF process. They know, very basic of it, and especially now with a lot of reproductive immunology, that's really foreign to them. But if you think about all that it takes to get you pregnant, just the fact that you are an IVF pregnancy, in my book, you're high risk. And, I'm sure Dr. Kills put you on that Lovenox for, he saw something in your chart. There's something that triggered that to be kept until 14 weeks. And I would actually do it, because if you made it to 12 weeks with the Lovenox, I would not just stop it cold turkey. I've had a few patients, for example, older ladies, lost pregnancy because they get transferred to the regular OBGYN and then they just cold turkey stop the progesterone. I've had 2 ladies, do that. So, for example, on my older ladies, patients with a thin C-section scar, patients with history of extensive uterine surgery, like, multiple myomectomies or multiple losses or stuff like that. I keep them on anticoagulation of some sort for 20 weeks, and I put them on progesterone till 36 weeks. So I would discuss that again. Most of us are really open to talk to your OB and explain what is the thought process. And honestly, if your OBGYN is not open to either talk to us or honor your request, then you need to find a new one. Okay. So this is an interesting question. Does the chances of a normal embryos go up because of IVF, because there's a lot more eggs and a lot more embryos? That is a good question. I don't have a perfect answer. I would imagine that the answer to some degree is yes. We are rescuing eggs that normally would have died. So chances of having more abnormal eggs just because of numbers and the rescue process that happens with the injections. The injections themselves, they're just high doses of hormones that you normally make. So the injections themselves do not cause abnormalities in your eggs and your embryos. What we are doing is actually rescuing the follicles and the eggs that would have normally died in the natural ovulation process. So by doing that, I am sure that we do increase rescuing maybe the wrong ones. However, I think there's still that natural selection, because you all know that we get, let's say, 20 eggs, and then you get, 10 embryos at the most. So I think there's still that natural selection that the poor quality eggs will either die early on or not fertilize or die off. That's why a lot of times which we do push the embryos to blast if there's a good amount, because that will show the stronger embryos and chances of them being normals go up. In terms of the PGT testing and the biopsies, that is the best technology we have, but it is far from perfect. You have to understand that the biopsy is taken from what should be the placenta of the future pregnancy. So there is a lot of kind of false positives in if you want to see it that way. What does that mean? That an abnormal, genetically abnormal embryo might self-correct, especially if it's, mosaic and stuff like that. So, I understand there's a lot of fear in this process of pregnancy, especially with having had multiple miscarriages. Um, I would, but life life is for the brave. Life is for, the people that are willing to take, the bull by the horns. So you can't live at the fullest in fear. And there's no way that you're going to be able to control fertility and implantation and the pregnancy process. There's absolutely like no way. There's so many factors involved, including divine intervention. I've said this like many, many times, because that's the reason that IVF is only 50% chance of success. There's still too many factors. And the more you try to control it, it's like Murphy's Law. It's like asking for more and more challenges and more dead ends. There is a point where you have to let go and let God and have that faith and just jump into it. Okay. This is not for the weak of hearts. Do you think an ERA receptiva test is necessary for a woman who has never been pregnant? No. A receptiva is a biopsy of the uterus to see if you're at higher risk of endometriosis. So if you don't have any symptoms at all indicating that that could be an issue, then I would not jump into that immediately. An ERA let us know if the effect of the progesterone matches the gestational age or the amount of progesterone that the endometrial lining has been exposed to. So neither of them are a cheap project. The ERA, between the monitoring, because it has to be a mock cycle, so between the monitoring, the medication that you have to take, and the actual biopsy is like $2,000. So if you've never had IVF and you've never really had any failures or miscarriages due to IVF, I would just try to go ahead and see what happens. And a lot of times miscarriages, it could be chronic endometritis. So in your case, because I went back to your question, if you've had, a few chemical pregnancies, so there is implantation going on. So then I would lean more towards a receptiva and working on the uterus itself. Checking for endometritis, so chronic infection, treated as chronic infection, endoscratch, PRP, just kind of work on that uterus, potentially check for coagulation disorders as well, genetic disorders, something else that's happening. I would not, my first bet would not be on an ERA. The receptiva more, the ERA not so much. Endolining less than 7 on the day of IUI, what is recommended? Sometimes what I do is I do vaginal estrogen leading up to the IUI. So if we're doing just a letrozole IUI cycle, then as soon as the letrozole ends, then I'll do vaginal estrogen for the next few days to build up the lining. If that still doesn't give us what we need, then we can do injectables, letrozole, and vaginal estrogen leading up to trigger an IUI. Is carnivore diet okay for non-alcoholic fatty liver while midday with intermittent fasting? I think that you should ease off on the carnivore, especially the really high-fat red meats. I think that you should add some greens, okay, especially broccoli, cauliflower, kale, spinach, to kind of clean that liver. All right. Um, Beets is really good to clean the liver as well. Intermittent fasting is actually very beneficial for the liver. I was the other day, somebody brought up the fatty liver disease. Doing a cup of black organic coffee in the morning, it also helps clear that liver. So I would back off on the 100% carnivore and red meat if you're having any liver compromise of that kind. Back off on the fat, a little bit. So still be low carb, but creep up, get those cruciferous greens in there to help the detoxification, especially the phase 2 detox of the liver. It's really dependent on those sulfuric components and methylation components that this type of vegetables would provide. If you are prepping towards IVF, then I would put you on liver friendly supplements like milk thistle. Like I was saying, there's certain beets, supplements that will help the liver flush. Chamomile, dandelion root help the liver, clear the liver. So between that dark coffee in the morning, organic, a herbal supplement for the liver, back off on the meat and the fat, add cruciferous vegetables, those very green greens like Brussels sprouts, broccoli, kale, cauliflower, spinach, and then monitor your liver function, okay, your liver enzymes. Yes, so the ERA, the side effect is that you determine the most optimal times of transfer, but it is based on measuring the effect of progesterone in the endometrial lining, and that's where the biopsy is. That's what it does. So we're measuring the effect of the progesterone. Okay, we're comparing it. What is the receptor activity based on the amount of progesterone, and then if it matches, it stays the same. If we need more, that's where the embryo gets transferred, either more or less. But the reality is that 80-90% of women have a normal ERA. So we do the test for a small group. So it's a pretty expensive test for a small group. So it's not like the first thing to do when you're starting your IVF journey, or after like one failed transfer. That would not necessarily be my thing to suggest for you. All right, so one question about freezing eggs versus not freezing eggs and how much to take supplements, whether CoQ10 and other supplements. Priming means a lot of things for a lot of people. In my book, the Verdialis priming, I like to prime people 1 to 3 months prior to doing any type of fertility. So ideally 2 to 3 months, with the diet, the supplements. So that is how long I would take the CoQ10, whether you freeze your embryos or whether you freeze your eggs. Does high testosterone affect IVF? Yes. Like I was saying earlier, too much of a good thing is a bad thing. So low testosterone, low DHEA, it is associated with decreased fertility. Excess testosterone, excess DHEA is that PCOS type of scenario. It's going to mess up your hormones, insulin, inflammation, and make your eggs more immature and less quality. So the extremes are bad. So if your testosterone is 95, that is high for a woman. and we need to do things to bring that down. Something fairly easy would be metformin. Metformin actually decreases testosterone. All right. Okay, people. So time's up for tonight. If you have any questions about supplements, what supplements to take, when to take them, how to do priming to improve your fertility journey, or any, anti-aging questions. I love anti-aging in general. It's one of my things. You can definitely write to me via Messenger. It's the best way to reach me. If you also want to talk to me about your particular case and need to get on my schedule, again, just message me. Make sure you put your name, your date of birth, and your phone number. So if you're in the system, we can find you, and otherwise create a chart for you and try to get you in as soon as possible. One of the girls usually will call you in the next 24, 48 hours to get you in, not necessarily that you'll be in the next 24, 48 hours. Okay. I want to invite all of you to our wonderful event in Georgia. It's the V celebration. Is V for victory and V for virtue and V for victor. All right. So, and V for vagina. So let's all celebrate the miracle inside of you. Dr. Keels will be our guest of honor, so you'll be able to talk to us. It is October 7. You can find tickets in Eventbrite. It is in a beautiful venue right next to the Yellow River. It's absolutely gorgeous. There'll be lunch included and a few sharing activities. Come celebrate, you know, the miracle inside all of you. Again, October 7 is the V celebration. Let's celebrate the miracle inside all of you at the Vacoma venue in Snellville, Georgia, which is east of Atlanta. It is in Eventbrite. So may you all be blessed. I'll see you guys next Monday morning for our challenge of the week, Wednesday night for our questions and fertility meeting, and then Thursday, so tomorrow morning, it'll be the Spanish crowd. So many blessings and a lot of love from Georgia. Bye-bye.